Namaste, my name is Vishwambhar Nath. I'm a urologist and transplant surgeon, kidney transplant surgeon at Pace Hospital in HITEC city in Hyderabad. Some of you may have seen an earlier talk by my nephrology colleague Dr. Kishore about various pieces of information about kidney disease, kidney failure, treatment options, etc. In continuation with the same theme, I thought today I will speak about kidney donation. The reason I think this is important, the reason I chose this topic is that having worked in transplantation field for almost 40 years now in India and abroad, I have noticed that more so in our country than elsewhere, there seem to be fair amount of misinformation and misconceptions about kidney donation, which prevents many people who need transplantation. It prevents them from getting a transplantation or getting the best possible transplantation. I will explain these things as I go along. Just like for blood donation, if the donor blood and recipient blood do not match, it can lead to serious complications and sometimes even disaster. Similarly, if the donor kidney and the recipient's tissues, they do not match, it can lead to a lot of serious complications. The reason I'm explaining this is, as I will elaborate later, there are different types of donors. They can be very closely related donors, donors who are related but not so closely. You can have kidney donation from somebody who has died. It's called deceased kidney donor. Disease not as in illness, but deceased, D-E-C-E-A-S-E-D, deceased kidney donor, etc. The better the match, the better the long-term outcome of the kidney transplantation. So the basic point I'm trying to make is, if there is a choice, the best possible transplant outcome is from a closely related donor. Closely related, we often also refer to that as first degree relative. This basically means brother, sister, child, if the child is an adult, or parent. So these are called first degree relatives. So if possible, the best transplant result is from a closely related donor. The next best result is from somebody who is related but not so closely related, like cousin or uncle, etc. Basically speaking, I think we can think of kidney donors as two types: living donors and deceased donors. I will talk today about living donors primarily. So as I said, closely related first degree relatives, other relatives. Sometimes somebody may be emotionally related and motivated to give a kidney. For example, a spouse. In rare situations, nowadays it is possible in our country to seek approval or permission from the appropriate state authority and have a kidney donation from somebody who is not related but is willing out of goodwill to come and help somebody who needs a kidney. There are certain situations and there is a procedure for doing it. But as I said few minutes back, if possible, best transplant is by kidney from a first degree relative donor. And that is why I want to make a point that there are many situations, we see many patients who need a transplant and for various reasons, close relatives are not willing, mainly because they are worried, they are concerned about effects on their ill health, etc. They're not willing, and therefore we'll end up going for the next best choice. The purpose of this talk is to try and show you reasons why donating a kidney has many benefits, not only to the recipient but also to the donor. The first step, of course, is to check the blood group of the potential donor and make sure that it is compatible with the recipient. That's the first step. So if somebody has kidney failure and needs a transplant and people in the family are willing, then we screen the blood group of various family members to see who may then be evaluated further to become a possible donor. The next step is very detailed counseling to the donor, potential donor, to the recipient, to the rest of their family, explaining basically what I'm explaining in this talk, giving them information as to what kidney donation involves, what are the effects on the donor, what are the benefits to the recipient, are there any benefits to the donor also, etc. The next most important step is we take voluntary consent in completely confidential manner with the donor alone. No other person is present there. So the transplant team will talk to the donor and make sure that they are volunteering entirely on their own and not due to some kind of pressure from within the family. It is surprising, it's not uncommon for there to be either overt or subtle pressure from the family for one person to donate the kidney. So we want to make sure that the kidney donation is completely voluntary and therefore this consent is taken confidentially. One point I'd like to highlight here is, and this is a practice that we have been carrying out for many, many years, 4 decades. If the donor has any reluctance and we sense that there is some kind of pressure within the family, our practice is we find some medical reason to declare the donor unfit so that there is no tension within the family. We take the responsibility. If we feel that the donor is under pressure, we will find some reason to say this person is not suitable. So I want to make that point very clear. The kidney donation has to be completely voluntary, and if there is any pressure, any good transplant team will not accept that donor. The next step is extremely detailed medical evaluation of the donor. To one, make sure that the person is very fit, and two, to make sure that by the act of donating the kidney, he or she will not come to any long-term effects on their health for the rest of their life. If, for example, we find that the donor has very subtle changes of some illness which may affect kidney health for that person in the future, examples being maybe somebody has a tiny piece of stone, or somebody has mild diabetes, etc. Somebody has some abnormalities in urine testing. These things, then we become very, very careful, because what we no good transplant team will accept that for the sake of treating a patient who is a recipient, we put a healthy person's life and future health at risk. So we do very detailed evaluation to make sure not only that the donor is very fit, but as best as we can determine, will not have any long-term ill effects on the health in the rest of that person's life. So carrying on, after ascertaining that the potential donor is volunteering completely on their own free will without any pressure, and making sure that they are in excellent medical condition and can withstand the surgery and go on to have normal life after kidney donation, we proceed to the next step. One point I'd like to clarify here, and this is a concern that some people have asked me, is people feel if I have 2 kidneys and I donate 1 kidney, then I will become weak because one important organ from my body is missing. Now, there is a little bit of a fallacy here, and that is a little bit of technical detail. Kidneys consist of millions of tiny functioning units called nephrons. So each kidney has million nephrons. At any given time in good health, most of these nephrons are just standby. They are not actually needed. So the number of nephrons needed for normal kidney function is surprisingly small. To put it into simple terms, if I have 2 good kidneys, normal kidneys, and I donate 1 kidney and I'm left with 1 normal kidney, that 1 normal kidney is enough for my normal life for the rest of my life. There are a couple of pieces of information in the background of this. As doctors, we know that not everybody is born with 2 kidneys. It is a variation of normal that some children are born with only 1 kidney. And the person who is born with only 1 kidney does not have kidney disease, because that 1 kidney is enough for normal life. If somebody has disease in 1 kidney and that 1 kidney becomes non-functioning and the other kidney is normal, removing the diseased kidney does not cause any long-term effects on that person's life, because 1 normal kidney is enough for normal longevity and normal quality of life. In fact, half of 1 good kidney is enough for normal life. So this forms the very basis of why it is possible to donate a kidney and then continue to have normal life for the rest of your life from that point onwards. Coming back to the evaluation of the donor. After ascertaining that they are medically fit and will not have any problems in their health after donating kidney, the final test which is done is called a tissue cross match. It is done once close to the time of transplantation, and it is usually done the second time 1 or 2 days immediately before the transplantation to make sure that the recipient's body is not going to reject the donor kidney. So these are the tests done before we accept a person for kidney donation. To summarize, first we check that the blood group matches. Then we check that the donor is agreeing to donate completely voluntarily without any pressure of any sort. Then we do series of tests to make sure that the donor is very fit and is not going to come to any serious medical ill health harm in the future as a result of donating the kidney. What exactly does a kidney donation operation involve? Nowadays, when I say nowadays, meaning for the past 15 years or so, or some places even longer than that, a lot of kidney donation is done laparoscopically. That means it's keyhole surgery. Instead of having one cut and removing the kidney at open surgery, there are 2-3 tiny punctures. Most of the surgery is carried out through keyhole small cuts. And then a medium-sized cut is made to remove the kidney and take it for transplantation. This is called laparoscopic donor nephrectomy. And most of the time, if it is a left-sided kidney which is selected for donation, then it is done laparoscopically. In most centers, even where there are experienced laparoscopic surgeons, still now, most people, if they have to do a right-sided donor nephrectomy for whatever reason, there are certain technical reasons which may necessitate that you have to use the right kidney. If that becomes necessary, then usually that is done by open surgery. The reason I am explaining this is, if it is done laparoscopically, the recovery from surgery is faster, post-operative pain is less, and the person can go back to normal physical activities faster than after open surgery. This does not mean that open surgery has long-term ill effects. Open surgery is still a viable option. But wherever possible, to minimize kidney donor discomfort and faster recovery, we do left side. Left side is done laparoscopically, right side is done by open surgery. After laparoscopic surgery, most donors would go home in 3 or 4 days' time. By the time they go home, we don't have any restrictions on their diet or physical activities. We of course ask them not to engage in strenuous physical activities for some time, but normal physical activities, walking in the house, going to the living room, watching TV, going to the dining room, eating normal food, all that is achieved in a matter of days. If the surgery is done open surgery, for example, on the right side, then usually hospitalization is for 5 to 7 days, and then the person goes home and then again recovers over a matter of weeks. We advise kidney donors not to engage in strenuous physical activities for about 4 to 8 weeks, depending on what type of surgery they've had done. At the end of that period, we in fact encourage them to go back to normal physical activities. We do a lot of counseling and explain to donors that after donating kidney, we do not want any major change in their lifestyle. They can go back to their occupation, they can go back to do whatever they want to do after a period of recovery, 4 to 8 weeks. Depending on their age, they can get married, they can have children, they can engage in physical sports, whatever. So that is how a normal kidney donation surgery is carried out, and that is the normal expected recovery from that. Whenever we talk about medical risks and complications, my observation has been that most non-medical people, sometimes even medical people, find it very difficult to actually comprehend what we mean by low risk, what is high risk, etc. And for example, you'll see many people, especially who read up medical matters on the internet, ask a lot of questions about side effects of medicines and various things, which is good. They should ask questions, but they will not ask the same questions when they're eating chaat of a bandi or somewhere, and whether there is a risk of getting an infection from that, etc. So medical risks have to be understood in the correct perspective. So having said that, if somebody is having major surgery like a kidney donation, then certain things can happen. And there are certain complications which we consider not very important, because usually that complication will finish by the time the person goes home or in a matter of days. For example, if somebody has an operation and they get some fever, so it is a complication, but it's not a very serious thing because it will get better in a matter of days. Occasionally, somebody may get an infection in the operated area. Again, it's not a big thing. So these are minor complications which get better and the person is cured before they go home. There are certain other things which are little more serious. For example, after any surgery, sometimes there can be blood clots in the veins, or sometimes there can be little chest infection. So these also get better with time, but a lot of precautions are taken to make sure that they don't happen. But nothing is 100% in medicine or in life. Occasionally, small complications take place. Rarely, like in any surgery, not only kidney donation, if somebody is going to have a gallbladder removed or a prostate removed, or some kind of orthopedic procedure, rarely serious complications can also happen. And this entire process of any surgery for that matter, and particularly for kidney transplantation and even more so for kidney donation, it is very, very important for the transplant team, the surgeon, the nephrologist, the anesthetist, everybody to have very honest conversations with the patient and the donor, so that we tell them everything that we know, everything that they need to know, and we give them enough time to ask all questions, so that nobody feels at the end of the thing, if I had known this, I may have decided differently. So we discuss everything very openly. So rarely rare complications can happen. When I say that, I started off by saying it's important to try and understand medical complication rates with some perspective. So all over the world, one of the best people to calculate risk of anything are insurance companies. And many years back, insurance companies in the West calculated that the risk of coming to serious medical harm, including very, very rarely death, the risk of that happening with kidney donation is comparable to the risk of having a major accident, traffic accident, and dying if you drive 20 miles to work and back every day for 20 years in a mid-sized city in the USA. The reason I'm explaining this is, what this means is, yes, there is a small risk, but the risk is very, very small. It is equal to the risk of having a major traffic accident if you drive for 20 years. So these are the possible risks and complications from kidney donation. Beyond that, as a special group of people, kidney donors worldwide in the past 70 years or so, huge number of kidney transplantations have been done, and we have information on huge number of kidney donors. So we know, for example, that if somebody donates a kidney and we follow them up for 15, 20, 30 years after that, the kidney donor has a slightly increased chance of getting mild blood pressure and a slightly increased chance of getting some protein in the urine. These are not serious issues, but they can happen. And the thing to bear in mind is, the risk or chance of this happening is no different from first degree relative of somebody who had kidney failure. I hope I made that clear. So if I have kidney failure, my first degree relatives followed for many years have a slightly increased chance of blood pressure and protein in the urine. Similarly, if somebody is a kidney donor, there is a slightly increased chance of blood pressure and some protein in the urine. But this slight blood pressure and slight presence of protein in urine is not going to affect their life in a major way. This sort of summarizes, so far I have explained how we select a donor, how carefully we evaluate, what the surgery involves, what is the normal recovery period, what are the possible side effects and complications, etc. I mentioned a few minutes back that there are benefits to the donor also, apart from benefit to the recipient. And there are two types of benefits. One is, because once the kidney donation is done, all donors are advised to remain under careful medical checkup for the rest of their life, once a year. So this person remains under very close medical follow-up, and if anything were to happen, it gets picked up early and they get managed well. So there is a lot of good medical data to show that long-term life quality and longevity in kidney donors is very good. So there is benefit, because you then, for the rest of your life, you remain under close medical surveillance, so that if anything is needed, it is done quickly. The other thing which is difficult to measure, but everybody involved in transplantation all over the world has known, and if any of you either know or come to know somebody who's donated a kidney and you talk to them, one of the biggest benefits to the donor is immense sense of satisfaction that they managed to save a loved one's life. That feeling that I have saved somebody's life, the effects, the benefits of that on that person's sense of well-being is tremendous. I think I'll close this now. I hope that this has given you some information, given you some things to think about, and will hopefully work positively if by chance you or somebody known to you happen to be in a position where somebody close to you, a loved one, needs a kidney, and we can take a well-informed decision based on what I have spoken about, rather than get carried away and say no for the wrong reasons. Thank you for listening.